Hello, everybody. Hello. So this is your free billing and coding program. There are three subjects in this program: medical billing, medical coding, okay, and medical terminology. It's for certified professional coder. Okay, guys, certified professional coder. Okay, your entity is AAPC. Okay, you guys can go to AAPC if you want to take a look at what they have there. Okay. Um, if you go on their website, they will also even tell you what's going to be on their test and a roundabout, not exactly what's going to be on the test. Okay, so some of you have started a regular, what do you call it? Billing school. That's not the word I'm looking for, but regular formal traditional school where you walk in. Um, and they have pretty much the same type of material that we have online. So the books that you guys have, the books that you guys use, that I always show you, are the same books that they use in the school. Okay, I'm gonna do this one. I'm not sure what's going on with that one. All right. So look below, and there are links below that will give you um, ebooks. They will give you ebooks from Kindle, and they have about 35% of the material in there that you need. Okay, that gives you enough time to get your books. Okay, I prefer you to get the hard copies because you're going to need hard copy when you are taking your test. Okay. Yeah, I know I did like a little small segment this morning because I did something on Twitch and then I just did a little segment on this one this morning. But I'm pretty much using the same thumbnail. Okay. So here is your medical billing and coding Q&A book. Okay. This book tells you what coding is about. Okay. What billing is about. Okay. I have wonderful illustrations in here. After this chat, I'm going to do Whatnot and TikTok at the same time, and I'm going to be marketing this book. Okay, you can get it on Amazon.com or you can order it from me, whichever you want. Okay, you guys remember the medical terminology book? The medical terminology book will have your tests in it. Okay, this book has 51 quiz in it. Okay, and that gives you a lot of medical terminology. You can also get this one on Amazon. Okay, you can get that one on Amazon. The medical billing, you can also get the medical billing book. I have not put tests in here. I didn't intend to put tests in here. This is your medical billing study. Okay, but YouTube, I would like for you to get the medical terminology book from Amazon. If your mom or your auntie or someone wants to know about the medical billing, directing them to get this book. Okay. If you go on sapphirephysiciancoding.com, you will also see that book there. I think it's also an ebook on sapphirephysiciancoding.com. Okay. So that's a little bit of what we're going to talk about today, and then we're going to kind of go into that surgical section. We've already done the surgical section, but I'm just kind of backtracking this, kind of talking about it because some people want me to talk about that again. Okay, and we can. So remember, if you guys have any questions, let me know. Okay, I'm going to put my docs up over there. Okay, so I can see your questions. So again, I still didn't get any snow. It's still a little bad out, a little the rainy, wettish, and I think that's why my Wi-Fi is on the Bagada. So that's why I had to delay this chat again. Okay, but generally, you guys know what we talk about. I want you guys to make sure you have your books because I'm not going to continue to put the books up and leave them up for such a long time because I need to make sure that you guys have your books. Okay, I am going to put a few books up in a few minutes because I need to show you guys which books you need. Okay, so again, your medical billing is in that playlist. It's a playlist. It says um, free course. Okay, and then you're going to do the medical billing, same in that same course. If you want to again do Sapphire Academy, just go on Sapphire Academy online. Okay, and you will get into Sapphire Academy. So let's jump right into the surgical section. So we talked about the surgical section. Make sure you have your books. You guys should have done the reading for the surgical section, which entitles you to do the guidelines. Now, if you have your step-by-step book, make sure you use that material. Make sure you use that material because that's what's going to help you in the long run. All these tests that you're doing, okay? And all these tests are going to help you to retain what you're doing. Retain what you're doing. Okay, so next question, what was it? Okay, the medical billing book. The medical billing book, let me see if I got it up here. The medical billing book is the same one that we've been using in school for years. Okay, this is just an updated version. I think I showed you guys this book before. This is also for people who may have not been in my classroom before. That's the book that you would get. Okay, so especially if you have a lot of time on your hands, okay, I want you to go ahead and get the books that you need. Go to elsevier.com, look down below, it should be there. Okay, so I'm also going to put the ICD-10. Now, I use the ICD-10 for physicians. I also have the one for hospitals. The reason I use it like this because it's teaching material. I have a teaching book. But you're going to get the regular ICD-10 book. I'm going to show you that one in a little bit. Okay? I also want you to get the step-by-step book. Now, most of you already have the step-by-step book because a lot of you are already in my class. I'm not sure why I have this up twice, but get rid of that. 2026. All right. So the step by you don't have to get 2026. That's you do not have to get that. Most of the books have the same stuff in it. I mean, they haven't updated that much with your dire need to get 2026. Okay, guys. I don't think it's necessary. I think that you can go from 23 up. Okay, because you're going to have your CPT book that will have current codes in it. Okay, current codes in it. But if you can get the new book, go ahead and get the new book. But I have, like I said, I have given you those links, and you are, definitely welcome to use those links. Okay, just click on it and it should open. If you do choose to buy your ebook from Kindle, go ahead and get the book from Kindle. Okay, nothing's wrong with that. You could even get both. Some of my students have both to use. So again, the surgical section that we just came from, I want you guys to make sure that you go over that because in integumentary system is going to be tough. The skin is tough, okay? And we've already went over how to code. We went over ICD-10, we went over CPT, and some of the earlier classes. So you guys should be able to do the coding right about now, okay? Even if you get 3, I don't care. As long as you show an effort, you're showing your effort. One of the questions was, do I think the coding exam certification is worse than the license for insurance agent? No. I almost thought vice versa, but no. Those of you who do want to join my team as a licensed agent, you're going to do a lot of reading. I mean, there's 6 segments that you're going to do. There's videos that you're going to do. The same exact process that you're doing here is what you're going to do there. You're going to make sure that you retain over and over. You're going to have modules. The only difference is it's not on YouTube. You have to go into the site. But let me DM me and let me know if that's a route that you want to go. And if you guys live in Atlanta, Georgia, and you know somebody who needs life insurance, you guys let me know, okay? Or, to join my team, you can live in any state, any one of those states, even Canada, okay? So I think the insurance test might be a little bit more of a fickle. because you got a lot more to retain. In coding, basically, you're just learning how to code. All your questions are going to be pertaining to the coding. In insurance and life insurance, you have a lot to remember. Okay, you have a lot to remember. But, any rate, I want to make sure that you guys all are on the same page. Now, some of you who are starting my class in different times, I want you to go ahead and look at those chats before time. Okay. We had a little chat earlier, but it wasn't really a big thing. I just kind of came on, kind of informative. I was kind of testing out some stuff to see if it worked. Okay. So, like I was saying, in the surgical section, you had things that you had to go over that we actually have already done. Is that the workbook? Hold on a minute. Okay, so we are still we're in the CPT section. Okay, as you guys can see, I'm gonna pull this up real quick. We went over a lot of work. You guys can see over here the anesthesia, general surgery, and then integumentary. Yeah, we're up to integumentary. So as you can see, this is the series. So when you see surgery guidelines in general surgery, right? I'm just gonna click on that just to get me to that section. So this is what we went over. Okay, these are the topics. Open your books, okay? In case you can't see this. Okay, these are the topics, and that was the objective here. But what I want to show you is, you see how the guidelines are here? This is Introduction to Surgery section, Notes and Guidelines, Unlisted Procedure, Special Reports, Separate Procedure, Surgical Package, General Subsection. That's what you were to go over, okay? We touched bases on it in class, and the rest of it was pretty much your homework, okay? So once you get to the integumentary system, okay, this is pretty much your introduction to the integumentary system. We always do a kind of like a formal introduction, okay, before we actually hit the gusto. So this is the integumentary system, okay? And in order for you to start the coding on the integumentary system, you have had to do the prior classes, or you're going to be in the dark. Okay, so those of you who are starting my class ahead of time, yes, I want you to go ahead and archive those classes. Okay, archive those classes before you get to this so that you are not in the blank out. Okay, so here in integumentary system, as you can see, is chapter 14. Okay, your topics that we are going to be talking about is integumentary system. If you open this up, you will see it. I'm not gonna open up format, your skin, subcutaneous, accessory structures, nail, polydental cyst, introduction, repair, closure, burns, destruction, breast procedures, chapter review. Now, and your objectives pretty much says this. It pretty much says the same thing. It's just repeating. This is a touchy section because there's a lot of things that's invasive in here. So when you are touching the integumentary system, you're going to have your CPT book open, have your ICD-10 open, have your step-by-step open. You don't need the workbook open because you're not going to do that until we finish with class. You're going to do that when you go home, when you know what I mean. So this is a touchy section. There is portions in this section that has babies. Pediatrics is in there. And you guys know I don't do pediatrics. Now, when I was in the OR, why they had it over in Schneider, I don't know. But the OR was in the Schneider pediatric building. And yeah, I had to go back through there. And yeah, that's another reason why I left the OR. I can't do the babies. Okay, so just be prepared today. Even the language of medicine book, okay? Even the language of medicine book is invasive. And you'll know that some of that book, I couldn't even get through. But those of you who are possibly going into pediatrics, now, if you wanted to be a doctor when you was younger and for some reason you just didn't get there, code for pediatrics. Okay, it'll be just like you're a doctor in the hospital. The pediatric section is a section that I have not chose to go into because of just the touchiness of it. But here is the book that you're supposed to have. And I know I haven't put this book up in a long time. That's because you all already got this book. But some of my new students have not seen this book. This is your language of medicine book. We have went through this book page. This book is this big. And thank you all so much. Y'all hung in there in the medical terminology class. And we hit that book page by page. We talked about so many things in that book. We talked about so many child diseases. We talked about dysfunctions. We talked about aneurysms. We talked about everything. But this is the book that you will need, okay? I believe it's in the description below. It's another, again, I believe I had pulled it out of Kindle. But you can also go to elsevier.com and get this book. If they ask you for the school, Sapphire Physician Coding, LLC, Waterbury, Connecticut, okay? Those of you who are not in the Sapphire Academy, yes, you need to be in the Sapphire Academy because you have to have a student ID. Okay, you have to have a student ID. So you can't just go in and then you Sapphire Physician code it and so and so. If you've done already, if they give it to you, did you give it to you? They're supposed to give you some kind of discount or something, but you've got to have the school code to get the discount. Okay, so again, when you join Sapphire Academy, you get everything just like you get in the regular school. You get your email, you get your sign on, you got to get in the website, same thing. So, again, depending on, where you want to work. If you're going into pediatrics, make sure that you're good on pediatrics medical terminology. Okay, the medical billing is to get you started. The medical billing is to get you in the right place in case you have to move around. I'm talking to the coders. In case you have to move around, okay? All of my coders know medical billing. If I have to send somebody to a facility, she knows medical billing. Because she's not going to always do coding. Maybe Miss Lisa, I don't feel like doing the coding this week. Okay, I'm going to send you over there. Go on over there with Dr. James for 2 weeks and help him with the billing. You see, I can do that because she's already trained for both. So that's the reason why I also train you guys for the medical billing. Okay, so instead of you just getting the coding, you get the medical billing. If you see all of the medical billing schools, they all do the same thing. Okay, the medical billing is, again, a part of finance, and I think it should go hand in hand. But my class generally focuses on coding. That's it. We code straight down the line. The billing just got in there because people kept asking me for the billing. And the billing course actually has 15 classes. Your medical terminology course is about 25 classes. And like I said, if you want to catch up and get to where we are right now, I want you to go ahead and start archiving. We may get a big snowstorm. You guys may be off on Monday and Tuesday. Try to hit 4 classes, 2 classes, whatever you think you can do. Just try to do it so you can catch up with us, especially if you are a beginner. And again, the schedule is in there. I went over a lot of my chats last night, and I did find that one in there. So it's entitled schedule, and that's for everybody. That's for all of you guys on YouTube to kind of keep up with what you're doing. Like I said, we want to make sure that you got everything that you need when you're taking your CPC. I was speaking to somebody the other day, and it's almost scary, when they're getting ready to take their test. But what you're going to do, continue to take your pre-test. Continue to take your exercises in the back of your CPC guide. When you go on AAPC.com, okay, this is it. When you go on AAPC.com, they have little tests in there. They used to be $10 and $12. I'm pretty sure they've gone up. I haven't even looked at those lately. But they have pre-tests in there that you can purchase they were $10. I'm gonna go on there tonight. Let me see if they went up. I need to ask Keisha see if they went up. I don't know, but I'm gonna go on there tonight. But and this is for those of you who are already in a building school and you're getting ready to take your test. They also have tests in. So if you're not in the Sapphire Academy, this is another way for you to get tests. They may be $15 or $20 now, but at least you can get practice. You can get practice in taking some of your exam. So, don't get afraid of that. But your medical terminology book, you must go through that book. You must do the exercises in that book. If you miss that class, this is your go-to. This will be your go-to. Okay? This is on Amazon.com. Okay? Go to Amazon.com and order this book. Okay? This will get you caught up with the medical terminology. And some of you all who already been in the medical terminology class, I want you to get this book anyway because the tests are in there. Remember, there are 51 tests in there. Okay? And that's part of your medical terminology course. Okay? So, again, after medical terminology is your CPT course. So you have your step-by-step book. That is what we're learning by. That's what we're teaching by. Okay, so the surgical section that we went through the other day, I didn't think it was that invasive. I mean, all it is reading and doing your exercise. Once you start doing the practice and going over the videos and looking up what you need to look up on YouTube, I think you will be fine. So you guys remember when I said, is that the surgical section? Yes, that's integumentary. Listen, when you go on YouTube, I'll tell you, I found so much stuff on YouTube, which is it's ridiculous. Look at some of those surgeries on YouTube. Because, let's say integumentary system. You want to see a surgery involving integumentary system, a surgery involving the skin or burn, pull it up. Pull it up. Type it in on YouTube so YouTube can show you a surgery just to give you the right idea. Now, remember, when you are looking up ICD-10 code, okay, that is the disease. That is what's wrong with the patient. You're not going to go straight to your index in the book, okay? You're going to look that medical terminology up, look that term up, and then it's going to take you to the right place. But it's up to you to choose the correct word, okay? Correct term. Okay, I'm going to use term. Okay, I'm going to, let me close this, and then I'll pull up that ICD-10 book, the one that you guys use, okay? Because I don't want you to get mixed up with from the tabular list to the index, before I get mixed up with tabular and index. Okay, so let's get this. You guys already have this book, and you guys know when I have my chats, I try to put the links on the side just so it's easy access for you guys. So my book is the ICD-10 Physicians, and I have ICD-10 Hospitals. The book that you guys use is a regular ICD-10 book, which you can get from AAPC. Frequently open. Yep, that's the one I want. Of course, AAPC has all the books that you need. Okay, now I'm not going to say what the price is, but it could be pricey. But this is why I give you all of these books. Okay, let me give you this. This is Elsevier. That's just, I haven't given you this. I'm going to give you this right now. Let me see if it lets me. All right, copy. I just want to copy everything. Why we got to copy link? Okay, hold on. Let's see if this works. So, no. Okay, wait a minute. I don't know what that is. So in Elsevier, you need to have the ISBN for the book. Well, I don't know why it's giving me all this stuff here, which I'm pretty sure you guys probably have already. Let me see. Yesterday this wasn't working, so let's see if it's working today. Okay, looks like it's working. Okay, so that's Elsevier over there. Okay, that's where we get the books from. Okay, so you can, click on that and open Elsevier, and then you can see the books put in step by step, put in language of medicine. They do not have the CPT book. They will not have that book, AMA. You would need to get that from Amazon, or you can get that from AAPC has that book, or you can go straight to AMA and get that book. If you go to AMA and get that book, you just need to go to the store. And the store, if you click on store and you click on this book, it's going to take you right back to Amazon. Okay, but look how I wrote it. That's not how it is. Okay, I think I got it right now. Okay, so again, when you do get ready to take your classes or take your courses, just know that it takes time for you to kind of get used to a different field or a different skill or something like that. Don't get yourself discouraged when you're reading and you get to the point where you go, all right, I can't. That means it's time for you to stop reading. And then if you get disgusted like that after an hour, then you can only read an hour. Don't read more than an hour. Um, I usually go 3 hours, and after that I'm disgusted. I'm okay. That's enough. Okay. Don't say it the way I'm saying it. Okay. So again, I'm still going to give you that other one. Hold on. When you are testing, just make sure you have everything that you need to test. When you go on my bookstore, go in the bookstore. When you go on my website, I haven't even put that up. Okay, that's a step by step. IBSN. Hold on. IBSN. ISBN. Hold on. I think that one. That's step by step. So that's just step by step. Make sure you use that. And again, that's down below. I really don't have to put that up there because all of that is below, but I just want to touch bases on that. This is my website in case y'all want to go and take a look at the bookstore and what I have in that bookstore. In that bookstore, which where you going to register for the Sapphire Academy. And again, the Sapphire Academy is your resources. Okay, that is your resources. That program is your resource. Okay, hold on. Did we do this already? Did I show you guys the other book? Yeah. You know what? I wanted to show you. Let me get back in here. Where that coding was in here, because some of you asked me about the medical billing and where the coding was in the medical billing. Okay, so the coding in the medical billing is it's a little small section. Remember I showed you yesterday the CPT section that's in there in case you don't want to do coding. Okay, some of you don't want to do coding. Some of you just want to do, the medical billing. So in the medical billing, let me just click on that. Okay, so it's in Unit 3 of the book. Because who was that? Stacy asked me about the medical billing. The medical billing does not only have to consist of just the medical billing. There are sections in there that have to do with the coding. So this is what we was talking about yesterday as far as that. See this little section here? We did that. We went over it in the classroom. But these sections here, I normally move them over with the coding. But we did kind of go over this, and this you can go over as well. This is for those of you who are not headed for the coding. Okay, you are not heading for your CPC certification. Okay, this is just giving you an introduction. It's giving you an introduction of the coding. Okay, and that's in the medical billing book. Now you do have exercises in there. You do have exercises in there. So it's not just you have the book and you don't have anything to do. There are exercises for you to do with that book. Okay. So, us being in the integumentary system, I got so many emails from you guys. I decided to I'm gonna hold off for a second because a couple of you want to join this class and you're not quite up here yet. And I know a lot of you do the archiving, but those of you who are with me now, I want you to go ahead and open your book to integumentary system. Now, remember, if you haven't finished the surgical section in the beginning, if you haven't finished everything that we have done up to the beginning, since we did, you remember the evaluation and management, which was tough. Wasn't it tough, y'all? You still have to know evaluation and management and anesthesia and medical terminology and the surgical system, all of that in a whole before you jump to integumentary system. Now, let me know if you guys do not have your books. Let me know if you don't have your book, because you're going to need your book, okay? So in this class in the integumentary system, it will be the same process that we have been doing. The only thing is that I want to make sure that you guys are able to do the coding. So in your CPT book, you remember from when we first started doing the coding, I said to go through your CPT book page by page. This is your go-to. These highlighters is going to help you to determine which codes you need to use that do not look the same. Okay? Because you might have a code, the last number is the same and the one before the last one is different. So that's why I told you guys to use your highlighter when you see codes that are like that. And yeah, they're going to be all throughout your book. But trust me, when you get ready to take your exam, it's going to be a help to you. It's going to be a help to you, okay? Because when you get ready to take that exam, you want to spend as less minutes, seconds, chromosomes as possible on one question, okay? So, and I don't know what kind of this one. This is such a beautiful one. It's such a sharp yellow. I know, y'all know, like pens and all this kind of stuff is like my pet peeve. So if you guys have any questions for me, go ahead and type them in, or y'all can go ahead and DM me and I'll kind of get back to you. So in the integumentary system, we already went over what the topics are. You guys are going to do that at home, okay? And it's only 7:32, so you can actually do your theory when you're done with me, or you can start Monday. It doesn't matter because I don't know, the Wi-Fi keeps acting up. Hopefully they fix it, but I can still chime it in through my phone. Okay. So integumentary system. The integumentary system subsection includes code. Now hold on, I'm gonna stop right there. Subsection. So you guys remember when we went over subsection. So you hear how the integumentary system right off the bat is talking about stuff that we previously did. See, that's why, because you can't start into the integumentary system and they talking that medical terminology talk, and you haven't done that. So that's why I always recommend that you guys go ahead and archive. Those of you who are coming in my class that haven't been in my class before, or doing the archives, okay. So subsection, subheading, category, we did that in the surgical section, okay. If y'all feel like y'all need to, more time for that, let me know. We're going to delay, okay. But again, this is just your introduction to integumentary system. We are not doing the class as a whole right now. This is your introductory to integumentary system. Now, in this section, it's gonna be rough. I'll tell you right now, but I'm pretty sure y'all can handle. Y'all did pretty good in the last class. Okay, y'all did pretty good in the class, and some of you did send me your work, which is that's fine. I mean, if you feel like you want me to look at what you're doing, if you want me to see your essay, because I require a summary at the end of each section to make sure you guys know what the subject is about. So if we're doing integumentary system, Sapphire Academy has to, they need to do an essay. Do they need to show it to me? I would like to see it. It should be in the file. But some of you on YouTube have been sending me your essay. That's fine. Okay, and it looks good. Everybody seems like they're on the right page. Okay, so in integumentary system, we talk about the subsections. In order for you to know what the subsections are, go back and archive, okay? The integumentary system subsection includes codes assigned by many different physicians and specialties. There's no restriction on who reports the codes from this or any other subsection, okay? You may find a family practitioner using the incision and drainage, debridement, okay, debridement, cleaning the burn. See, that's part of medical terminology. You see why we need medical terminology? Drainage, incision, that's all in medical terminology. Dermatologist, all in medical terminology. Dermatologist and dermatology is different, okay? So that's why we have to do those classes before time. I want you guys to be savvy, know what we're talking about. Okay, a plastic surgeon using skin graft codes or a surgeon using breast procedure codes. Okay, you'll learn about the integumentary system subsections by reviewing the subsection format and then learning about coding the services and procedures in the subsection. Now, we've already went over a lot of this, but again, this is your introductory class. This is your introductory to integumentary. This is where you are going to take that time and backtrack to make sure that you're good in order for you to move on to integumentary. Because here's where we're going to start doing the coding. One, you have to understand what we are doing. Two, if you archive the classes, you will be on the same type of level that the other students are, because everybody started at the beginning. Everybody started at the beginning. This is a self-paced class. If you're starting at a different time, you're just going by that same schedule. This is in there, okay? And I think I put the link there where that schedule is, so you guys can have access to that schedule, okay? But I definitely still recommend you guys to go ahead and do the Sapphire Academy, so that you can get all the resources that you need so you can pass your exam, okay? After this class, I'm going to do a whatnot real quick, and I'm going to go on a TikTok real quick, okay? So I'm going to be live on both of those. We're going to do live on both of those. If my Wi-Fi act up, it got to be another day. Okay, so again, just make sure your studying is adequate for you. I always recommend 2 hours a day, or 2 hours 3 days a week. But if you can do more, that's fine. But I don't want you to burn out and you got to go to work the next morning. Okay, so just make sure that you are good with what I'm giving you, because if you do too much, then that's how you're going to burn out. I don't want you to burn out. So that's why the classes that you had before Integumentary system, okay, go ahead and take a look at those classes, okay? So again, this is Integumentary system, and we're going to be going over the formats as well. We're going to be talking about skin, nails, cysts, repairs and closures, burn closures, laceration closures, breast and destructive tissue. Okay, so we talked about that, and I just kind of gave you a little bit of insight of what you are going to be studying and what you're going to be doing. So each subheading, here we go with the subheadings. If you guys didn't get on the class ahead of this, get on the class ahead of this so you can see where the subheading is. Okay, each subheading is further divided by the category. Okay, prior class. Okay, so you guys will have plenty of time, because the next class is not until Monday. For example, the subheading skin, subcutaneous tissue, okay, and accessory structures is divided into the following categories. Okay, incision, draining, debridement. We talked a little bit about that. Biopsy, paring, cutting, some shaving, excisions of tumors that are benign, excisions of tumors that are malignant. Okay, and they're pretty much lesions. Okay, lesions. Look at medical terminology. So I just want you guys to see how I can't show y'all that one. So yeah, there are some pictures that I will not show you. So that's why it's kind of when you especially when I'm going into Integumentary, there's pictures and things in here that are sensory that I can't really put up. But if you guys have your book, I'm on page 373. So 373, the pictures start getting a little creepy. But you have your book, that's where you should be at, okay? So I'm just going to kind of bypass that and kind of keep it going. Incision and drainage and, debridement, okay? When you guys worked I don't know how many of you worked in the hospital, or anybody who ever worked in a hospital, if you've ever seen somebody who had to have their skin with debridement. Codes in this category 11000 through 11047 describe services of debridement based on the depth, body surface condition, and for 11004. So go look for those codes through 11006. Okay, by location. Okay, the first debridement codes are 11,000. Okay, so go ahead and take a look at that. And again, we're just kind of backtracking through. And then I want you to, they have a whole segment in here that I do want you to look at that has to do with the CMS rules. Okay, here is where they're going to be telling you what you should and shouldn't do. Hold on. I want to put this up real quick just to kind of give you an idea. Right there. Okay, that's what I want you to do. Make sure you read that. And you can get ahead of the game and go ahead and read that. Okay, so an integumentary system, we're going to do the exercises in integumentary system. We're going to do that online. So when we get ready to do it, that's what we're going to do as well. Just make sure you guys have your books. So And below those books should be down there. If you're gonna, like I said, if you're gonna get a new book, you can do Elsevier, you can do Amazon, you can do, AMA, AAPC. They should have the new 2026 book. I would like for you to get the 2026 book. This coding class may last. I'm thinking to, if this is January, February, March. We might go into March. Your last class might be around March 22nd. That's your last class because I don't think it's going to go that further. Um, I used to do 2 and 3 classes a day when I was out, but I can't do that many classes anymore. I only can do like 1 or 2. But I still want you guys to kind of catch up. But this coding class will be finished in the middle of March. So you guys will have been done with the course. Okay. And then those of you who are ready to take your exam, you must join the Sapphire Academy so that I can give you those pre-tests. I can give you a lot of different resources. Okay. You don't have to. Okay, you can continue on your own if you feel like you have enough. Whatever resources you need to get, just make sure you get the CPC guide. Do I prefer you to join the academy? Yes, because you need to have a lot of those resources that are in there. Okay. Some of my students that were previous coders and they've come back to just kind of get abreast on things, or they've come back to kind of hit the step-by-step book again, or they want to kind of look at an EHR system, what's going on in the front end. Yes, they join the Sapphire Academy, and it kind of brushes them up. They don't want to sit down in the classroom, or they don't want to do the class for like an hour. They want to go in. They want to go in Sapphire and get out. And that's what Sapphire is. You guys can see the classes that I do here. This literally digital in Sapphire. You don't have to do everything you hear me saying is in Sapphire. It's already in there. It's in a digital format. So, sometimes, I have students that don't want to get in, on the class. So they're just working, and they just do Sapphire. And, as long as you're in the right place, we put you in the right place and take your exam and pass your exam. That's the goal, passing your exam. Okay. That is the goal, passing your exam. Okay. So, I don't know why that's like that down there. I don't know. We're not messing with that. Okay. So, again, in your book where the CMS rules are, I want you to go ahead and do those CMS rules. Okay. When you see illustrations like this, I don't think this is too bad. When you see illustrations like this, make sure you take notes. Okay, take notes on these illustrations because they are in your medical terminology book. Okay, but this is something you may have, on your exam. Okay, this is something you may have on your exam, and they're explaining what this is: lesions, excision, and destruction. Okay, I'm on figure 14.3. There are many types of lesions of the skin, and that's what they're giving you. They're showing you types of lesions of the skin. Okay, I would put them on the index cards just so you can be familiar with some of these words. Okay, and they're like fissure tears, fissure scars, cracks in the skin, ulcers, burns, different type of things that they would do as far as healing the skin, surgeries of the skin. Okay, and I'm just trying to see if you have, and here is closure of excision. Now this is going to be a fickle here. So, as you guys are reading this book, this is what's going to help you. This is just your step-by-step book. You're just going step by step. And like I said, as you read this book, have your CPT book with you. Have your CPT book with you so that you can see when it pulls up codes and you see these codes that pop up, you don't really know what they are in your head. Just take a look at them because that's what's going to get you used to going through your book. Those codes are going to get you used to going through your book. And that's the gist of it. Mastering these books, your ICD-10, your CPT, your HCPCS. And remember, we did HCPCS, some HCPCS in anesthesia. Okay, remember we did HCPCS in anesthesia because a lot of your modifiers for anesthesia is in your HCPCS book. Okay, we are going to go into HCPCS. There's a full class on HCPCS. But we're going to touch this much. You have to go to Sapphire Academy to get a little bit more of that. So again, you have to be persistent in what you want to do. You have to be persistent in how you're going to be learning. So, I don't want you guys to be afraid of diving into something new. Okay. So, if you guys have any questions, definitely let me know, or you guys can definitely DM me. Okay. Hold on one second. Uh, yeah. So, Linda just asked about the medical terminology book. The medical terminology book is also below. Okay. I also put the workbook down there too. So, that book, I'm not sure how far that one goes. Let me see. Okay, so this is it here. Let me see. Let me see. You guys can go ahead and open it. I have a link down there to open that book. I just want to see what's the depth of the book. So it's about the same, about 35% anti-kickbacks. Okay, so you guys can go ahead and open that book. So yeah, it goes all the way to the coding. The coding is in here. Hold on. Cost reports are in there. It's a lot of stuff in this book. So yeah, CLIA is in there, clinical laboratory improvement. So yeah, it's a lot of stuff in there. Okay, so you can go ahead and use that book till you at least get your other book. Okay, you can use that book till you get your other book. Let me just come down. 3.8, what to expect. OIG. Yeah, there's definitely a lot in this book. This is the medical billing book. Let me go ahead and pull it up. You guys know this book. We use this book for medical terminology. I'm just trying to make sure that there's enough of information in there for at least a couple of weeks to give you until you actually get your book. But I don't want you to try to get the books all at one time. Okay. Just try to get one at a time until you're able to get the book that you need. Using those ebooks that's in there, I think is amazing. It's a plus. It's kind of like a Kindle hack, especially when you don't have your books. If you do Sapphire Academy, you do get the language of medicine book. You get that book in there because that actually comes with the course. So the language of medicine book is actually in there. It's not this version. I think it might be 12, 11 or 12. I'm not sure which one it is. But that book actually comes with the Sapphire Academy, so you also get that book. So some students start Sapphire Academy and just start with medical terminology. And again, it's an independent course. I mean, you don't have to follow how I'm going, but I still want them to follow by their schedule. So if they take the schedule and let's say Tina tells me, Miss Lambert, I went right to Integumentary. Miss Lambert, I want to start on cardiovascular. She's gonna take this schedule and she's going straight to cardiovascular. And in the cardiovascular schedule, she's gonna follow it exactly how I'm giving it. Nothing should change. So, she's not doing anything that's out of whack because she still will go by the schedule. So as you see, each page of this schedule has all of your classes in there. So the medical terminology class that's in this schedule, it tells you what's in there, what you should be doing Monday, Tuesday, Wednesday, Thursday, what you should be doing. So, so that you definitely don't get lost. And when you get to ICD-10, it tells you you're up to your second quarter. This is your second quarter. When you join Sapphire Academy, this is an automatic download. You automatically get this. But I think I have put one on there for you. It's not like this, but it's just giving you an idea of a schedule so that you guys can follow a schedule. The CPT, this schedule should have, musculoskeletal system, respiratory, cardiovascular. So this schedule tells you what you should be doing, where you should be at. So when you're working independently, that's why I made the program like this, so that people are not tied down to one thing. If you focus on this section, then you go ahead and do this section. But in order for you to do this section, you need to have gotten through the first 4 or 5 sections. So this class that we're getting ready to do, this is actually, Integumentary will be your 29th coding class. I've already done 29 classes. So you've missed 29 classes. And that's because I don't do 3 or 4 classes a day. So that's why when you're doing the coding, you do your 4 classes, 3 classes. You don't have to do the one class, but that's how you're going to gear up to what you need to. That's why we have you archive the classes. And you using the schedule is going to keep you on track. Okay. When you join the Sapphire Academy, you get an automatic download of that schedule. Okay, it's already in that orientation. When you first come on, and you pay $99, the first thing you get is your orientation, and that's already in there. You get that, and you get your syllabus. Okay, the syllabus will tell you what you should be learning, how many hours the coding class actually is. Okay, when you look at your syllabus, it should say 60 hours. The coding class should say 60 hours, right? So we're already into almost half of that, right? We're almost into half of that. We're in Integumentary. So how many classes do we have left to do? What's that? If you pull out your step by step, y'all can look in there and see. Cause see, every single thing that you see in this sector, I'm gonna pull it up for you on my end. It didn't pull up. Okay, everything you see in this sector is what we're supposed to do. So in your syllabus, you should see in there the same thing in the schedule. Everything you see on here, you should see in the schedule. You should see in the schedule. So if you have Integumentary, okay, let me pull this up. All access skin, musculoskeletal system, that's 20,000 series. 30,000 series respiratory, cardiovascular, hemic, lymphatic, digestive system, urinary, reproductive, endocrine, eye, ocular, anadexiana, radiology, pathology, medicine, inpatient coding. That's the full class. That's your whole coding class. So, like I said, we just started in the gusto. We just started in the gusto. You are the one who's doing the bulk of the work because you're working independently. You're working independently. When they work in Sapphire Academy, the PDFs, the digital, and the Sapphire Academy all works together with what you have. But before you start the Sapphire Academy, you have to get an orientation. You have to do orientation. Orientation allows you to navigate the school. Orientation is where you get your email access from. Orientation is where you get your academy access from. Orientation is where we tell you about the program, what's in the program. The purpose of this program is to get you guys to pass your certification, your CPC. Okay, and like I said, those of you who are not taking the CPC, and you're just doing the billing and coding, or if you want to do your CPB, yes, you have to master that medical billing. Yeah, absolutely, absolutely. In your CPC guide, which I know I had over here, in your CPC guide, in the beginning of this CPC guide, there's a section in here called the business of medicine. The business of medicine is an introductory of medical billing, federal rules and regulations, and that is a part of your CPC. So once you guys get down pack the introduction, and your introduction, you have your CPC credibility, your clinical examples, information about the study guide, and they have a couple of other things up there. But when you get to the first chapter in your CPC, they say the business of medicine. The business of medicine is talking about different type of medical billing, different type of providers, coding profession, hierarchy providers. You must know what hierarchy providers are. They talk about RVUs. Didn't we did all of that in medical billing. So if you guys missed that medical billing, go back and get the medical billing. Okay, we talk about fraud and abuse. Abuse, I can't even talk. Fraud and abuse, high tech, medical necessity. So, and I'm saying that to say, in your CPC book, that little small section up there that's called the business of medicine, you must know that. They will ask you about that. You know what? What's weird? It's not weird, but they're also going to ask you about AAPC. They're going to ask you, when did the entity develop? They ask you, how many are in there? Well, we know it's over about 250,000. But this is just to give you the idea of some of the things that you're going to see on that CPC, okay? You must do the business of medicine, chapter 1. The coding is essential. When you get to the acronyms, make sure that what I have y'all do is actually write these acronyms down on the index card. You see those acronyms there? Write them down on the index card so you can get used to them. Okay? And then you have your chapter review. Okay? Which one is not a covered entity of HIPAA? I'm just saying that one. But that's just to give you an idea of what they're going to be. I got 3 minutes. That's just to give you an idea of what they're going to be asking you as it relates to billing on the CPC. But if you're not going towards that billing, then you don't need to worry about too much of what's there. Worry about what they're going to give you in the CPB. That little section right there will be in the CPP, okay? They do have study material for CPB, but get those 2 books I told you. You're going to master what's in there. AAPC also has extra exams and tests on the billing. Okay? And it's just to kind of get you used to what you're going to get into. Maybe you're changing professions, and maybe you're starting something you never did before. Okay, so absolutely. I mean, it's all about testing. It's all about learning. It's all about making a difference. Okay, because that's what you're really doing. You're making a difference. The coders make a difference because the coders are making sure that the bills are right. When you code and you're coding the correct, what's the provider give you the wrong code? They give you 65388 or something like that, and that's not the code. It may be a lower code. Next thing you know, they bill a patient $1,000, and oh man, that was the wrong code. Now there was no money left. The rest of it was a write-off. Okay, and yes, there's a difference between write-off and adjustment. So that's the stuff that we're gonna get into. That's the stuff. But we talked about a lot of that in the medical billing. But again, that's also a part of your coding. When you do Sapphire Academy, you see all these different things in there. You see things in the Sapphire Academy that you do not see here. But here you have ability to talk to me. I'm talking to YouTube right now because anybody in the Sapphire Academy, y'all know how to get me. This YouTube DM. YouTube, if you go to my website, you can get me there. You can go to the website. Okay, you can text me. Email me. My email should be also below. That's my school email right there that you guys have. So you guys can also email me on that if you want to. But sometimes you guys have questions, and I know some of you guys who do the archive. Talking to you guys who archive, you want to give me a question. And sometimes I don't know why, but sometimes I miss a message or two in YouTube. So if I do, go ahead and send me an email, and I'll get right back to you. Okay. So make sure you guys get your books. Okay. What time is this? 8 o'clock. In about 15 minutes, I got to set up the whatnot. I promised that I was going on the whatnot today. So I have to go on the whatnot. And I'm going on the whatnot, and I think the TikTok. And the purpose of me going on there is to sell the books. Okay, that's the purpose of me going on there, to sell the books. If the Wi-Fi acts up, I'm going to do it. I'm going to probably do it in the morning if I still have trouble with the Wi-Fi. Okay, because I can see it kind of blinking in and out down there. I'm hoping there's no holes in this video. Okay, I hope there's no holes in this video. But this section is over. So this was your introductory letter to the integumentary system. So those of you who want to join my class, that know I'm giving you an opportunity to go ahead and do the archive, so you guys can know what subheading is, subsection is, because we're going to do the workbook as well. So we're going to do the step-by-step book and the workbook. Okay, you have work in there to do. So you guys can get a heads up on that if you want to. Okay, so I'll see you guys tomorrow. Yeah, I know I normally don't do class on Sunday, but because everybody's in, I don't know, a lot of people probably might do church online, because it's going to be, bad. Nah, I don't see no snow, but there's a lot. It's shiny looking rain out there. Okay, so so I'm going. You guys join me on the whatnot. Okay, y'all know what it is, Sapphire Physician Coding. My TikTok is also Sapphire Physician Coding. You guys join me on the TikTok as well. Okay, I'm going to try to set it up in a few minutes. Okay, thank y'all for showing up. I'll see y'all again.